Welcome to Gracefully Graying. I am your host, Attorney Henry Gornbein. Today on Gracefully Graying, I am pleased to welcome as my guest Kate Zenlea, who is the Managing Director of the Global Health Initiative at Henry Ford Health System. We will be exploring some key public health issues that impact upon all of us who are gracefully graying, especially in this age of coronavirus. Kate, welcome.
Hi, Henry.
Why don't you tell us about your background in public health? And, I was thinking when we were setting up the show, you got your master's in public health at NYU. And it's now, public health is everywhere. You're on the forefront of the pandemic. So it's amazing. So tell us about yourself.
That's right. Thank you very much for having me. I'm very excited to be here. As you mentioned, I received my master's in public health from New York University in 2013. And there I had a specialization in both community and international health. So from New York, I spent a little bit of time in Argentina studying international public health before coming back to Detroit. And I've been with Henry Ford Health System for over 3 years now, working on several large-scale public health programs, both locally and globally. And of course, most recently, the main program we are focusing on is COVID-19 testing in the city of Detroit.
First of all, why don't you tell our viewers about what exactly is public health? I mean, let's get down to what that is.
Yeah, that's a great question, Henry. A lot of people actually are very confused by the definition of public health. So the technical definition of public health is that it promotes and protects the health of people and their communities where they live, learn, work, and play. So to kind of break that down, essentially public health is a science of examining health trends within a population, as opposed to treating individual patients, such as physicians would work one-on-one with patients. We look at the health trends of the population. So your risk of negative health outcomes in any population is really determined by a number of factors. And some of those factors can be your zip code, where you live, your education level, your income, your race, your age, your ethnicity. All of those social determinants really do impact your health outcomes.
Kate, what is the Global Health Initiative?
So the Global Health Initiative is a part of Henry Ford Health System, and we really serve to improve the lives of the most vulnerable populations, both at home and abroad. So we do this in two different ways. The first way we do this is we adapt innovative health solutions from global countries to our local health challenges. So the idea being that there are many health challenges in other countries that are the same as here in Detroit, but due to resource constraints, they very well might have come up with more innovative or creative ideas to address those health problems in these other countries. So we scan the globe, we try to find these innovative solutions, maybe solutions that we haven't thought up yet for a variety of reasons, and we try to adapt some of those programmatic elements to different pilot tests here in Detroit to see if that will improve health outcomes more so than we have done in the past.
Kate, tell us about the caregiver program. Exactly what is that for our viewers?
So the caregiver program is one of our many projects that's happening at the Global Health Initiative. This project in particular, it's funded by Michigan Health Endowment Fund, and it's a 2-year pilot intervention that's happening actually in Jackson, Michigan, where we have Henry Ford Allegiance Hospital. And this program really is serving caregiver and older adult dyads. So typically this would be a loved one, an older adult, a parent, and maybe their children serving as the caregiver that's really helping them to meet needs and helping them to age in place and keep them out of the hospital. The goal of this program really is to reduce caregiver burden and caregiver isolation. So we're focusing more on the caregiver in this program than the older adult. With the idea being that if we can reduce that burden for caregivers, then we are going to be serving that older adult in many different ways. So we really are looking to make sure that the caregiver has everything that they need in order to be successful, essentially. So really kind of creating like a community of care for this caregiver through a mobile technology, which is what we are using, called genusConnect. genusConnect really is, as I said, a community of care to address multiple caregiving needs. These users can connect anywhere at any time, and they can engage in a plethora of supporting tools and different resources.
Let me jump back. And first of all, we talked about Jackson. Who are the key stakeholders and grant partners with regard to the caregiver program?
So in this program, we're really, as I mentioned, we're trying to test a mobile technology to see if that really is going to reduce caregiver burden. And we want to do that in two settings, in both a community setting and a clinical setting. So we want to see if really those outcomes differ by engaging older adults and caregivers, whether in the community or in a clinical. So because of that, we have both community and clinical partners on this program. So our community partners are Region 2 Area Agency of Aging. They're located in Brooklyn, Michigan, which is within the Jackson, Michigan catchment area. As I mentioned, Henry Ford Allegiance Hospital, we're working with their population health department. genusConnect, which is the mobile technology with founder and CEO Joe Gleason. And Nora Health, who is our international partner, who I'll talk about more in a little bit.
What is the problem statement with regard to the caregiver program?
So there's a few different problems here of why we decided to really pursue this program. For one, if you look at it from a caregiver perspective, many seniors, rely upon informal caregivers to manage their physical, emotional, and social needs. But sometimes caregivers are often disengaged from their own health care and their own well-being. And that's really where we saw an opportunity. And this can often result in, poor health outcomes. They also can have an inadequate understanding of exactly how to meet the needs of their loved one. So if they're focusing on a specific disease state, they might not know all of the different expectations from the clinic or recommendations to help self-manage those conditions. And in terms of older adults, as we know, Americans are living longer, and it's really critical that providers and communities are much better equipped to manage these challenges of our aging population and really help them. Our ultimate goal is to help them age in place.
Kate, why is there a need to improve health outcomes for caregivers?
So there really is a need, as I kind of just went over, to improve these health outcomes, because we're really trying to prevent rehospitalizations from the older adults. So if we can improve the health outcomes of our caregivers, they'll be able to better serve the older adult in which that they provide care for. So rehospitalization is just one of the metrics that will really, our hypothesis is, will really be impacted by making sure that our caregivers are well taken care of. But as I mentioned, the most important thing is social isolation and caregiver burden are such very prominent and insidious problems within our caregivers. Many people out there who are a caregiver or have been a caregiver know that it's really a second job, and it can take everything out of you. And unless we really make sure that our caregivers are supported, they're not going to be able to do the job to the best of their ability, or really help their loved one to the best of their ability.
Kate, you mentioned earlier genusConnect. Let's delve into that. Tell us exactly what the objectives of genusConnect are.
So genusConnect actually, like I said, was founded by Joe Gleason. Genus, which means family in Latin. So this is really a family mobile application for caregivers, and we're seeking to onboard caregivers to genusConnect. I believe many other people throughout the region are using genusConnect, but it's never really been tested in a systematic or scientific way. So we're looking to really see what are the benefits and the impacts of genusConnect on our caregiving community. The platform allows caregivers and family members to coordinate communication, they can monitor emotional health, manage medications, manage conditions, and really the most important thing is really connecting them to resources. So the best way I can kind of explain what we do with genusConnect is examples of if you've ever, been caring for a parent and maybe there's multiple siblings caring for a parent, sometimes it's hard to know who did what with the parent when. So, for example, if the parent has a doctor's appointment next week on Tuesday, we can go through the app and say, who's available on Tuesday to take mom to her doctor's appointment? Or we can record our interactions with mom and say, just went to mom's house today, dropped her off lunch. We had a really good lunch today. She ate this, and that. And it really just kind of keeps all that information in one place and really makes sure that everyone who's involved in that caregiving network knows what is going on with their loved one.
Kate, as we're doing this show, we have passed a grim milestone as a result of the coronavirus pandemic that is terrorizing the world and impacting upon the United States, where we crossed 100,000 deaths as of yesterday.
Yep.
What is the impact of COVID-19 upon all of your work?
So, as many other people, we had to adapt once COVID-19 hit. We are the Global Health Initiative, but of course, global work is not really a possibility right now, and especially travel is not a possibility right now. So given our skills and expertise in public health as a team, we knew that we wanted to help out with the COVID-19 pandemic the best we could. So we actually teamed up with the Detroit Health Department, and we worked to operationalize their clinic within the health department to run the Abbott rapid testing that produces results for COVID-19 in 15 minutes. We also worked to mobilize mobile units that would go out to the community in congregate settings of vulnerable populations and really test our vulnerable community in Detroit so that they wouldn't have to travel to the health department. So we go to nursing homes, we go to homeless shelters, other adult care, long-term care facilities. And as of today, we have performed over 10,000 tests. We've been to over 26 facilities, and we are now expanding our work to do another 10,000 tests in adult foster homes and detention centers.
Now, you see the test being used with kind of a swab that goes up the nasal passages. Is that still what is being done, or are there other types of testing being performed now?
So there's two types of tests out there. So the tests that first were being used here in the Detroit metro area were those, as you mentioned, Henry, those nasal pharyngeal swabs. And those are the ones that went pretty far back into your nose, into the back of your throat. Those were effective in the sense that, they did provide accurate testing, but there were a lot of things that were wrong with those in the sense that they were much more painful for the patient. They produced a higher level of exposure to COVID-19. That testing mechanism does make people sneeze and cough a lot. So in the age of trying to, really manage that, that was exposing our testers. And the results took, anywhere from 4 to 7 days. So the Abbott testing, which is what we've been using at the Detroit Health Department, is a nasal swab, but does not go all the way in the back of the throat. This is done, it's much more painless. And the results, like I said, are done in 15 minutes. So that is our preferred method of testing, pending that we have enough kits, to perform, all the tests that we need. But we do use both mechanisms.
And are you satisfied with the speed and the fact that before there were complaints that there was not enough test kits available, not enough? Are we getting to the point where we're testing all who need to be tested?
We're working to test all that need to be tested. And of course, it's more than just testing, right? So once we test, we need to make sure that we're following up with infection control recommendations, and we're making sure that quarantine recommendations are being adhered to, and making sure that these facilities have enough PPE and that they have the education they need in terms of how to manage COVID-19, such as when should someone go to an emergency room or when should someone stay back. So there's still a lot to be done. We are working to test as many as we can. Like I said, the Abbott tests, those can be limited in supply, and that's due to a contract that we have with Abbott. And they only produce so many a week, so we get about 1,400 a week. So there are times that we do switch to the nasal pharyngeal swabs, but we are working to test as many as we can. And I think that we've done a pretty good job of reaching our most vulnerable. And like I said, continuing and retesting when needed.
Kate, right before the coronavirus hit, you were in India leading a group for public health. Tell us about that trip and exactly what transpired.
Yeah, so kind of switching back to the caregiver grant, to the caregiver program, really staying true to our mission. We believe that we can learn from other low middle income countries who have similar health challenges to the challenges that we have here in Michigan. But those countries, as I mentioned, can implement more creative solutions due to resource constraints. So in order to pilot genusConnect, we've teamed up with Nora Health in Bangalore, India. Nora Health is an organization. They train patients and their family members with skills to improve health outcomes. So they turn complex medical information into fun and entertaining classes. And they also turn hospital waiting rooms and hallways into classrooms. So we did travel, the team and I traveled to India to observe this program firsthand. We did a number of site visits, we did workshops with the team and different trainings. We were really keen on learning from them to see how we could adapt their certain parts of their program into our pilot program in the Jackson area.
And what else is the global component of your work? I mean, you had the trip to India. What else is globally pertinent that would be of interest to our viewers?
So the other thing that we do in terms of global, the concept of adapting health solutions from low middle income countries to health challenges here in Michigan, we call that reverse innovation. So looking to other countries, other low middle income countries, to really pilot here in the United States. But we do it on the flip side as well. So we also do a number of medical exchanges and trainings and research and infrastructure building in other countries. So essentially, wherever work at Henry Ford is happening internationally, that is where they would really call upon our department to strategize, coordinate, and design their programs and implementation. We're in our team alone. We work in over a dozen countries, and that's either setting up programs there or working to learn from them. So it's really kind of this cross-cultural communication. So we learn from them, we adapt, but we also teach them some skills that they need as well to be successful.
What is Nora Health exactly?
So Nora Health, which was the organization that we visited in India, they have a very unique approach. So they're focused on human-centered design. So really what human-centered design is developing solutions by involving participants, by involving the human perspective into every step of the problem-solving process. So they make sure that whoever their target audience is, as they're designing their programs, they're checking in with them every step of the way. So any piece of the program that they're designing, they're going back to the community and they're testing it with them and they're saying, hey, does this make sense to you? Is this culturally relevant? Do you understand this? Is this something that's feasible for you to use? These are all questions that if they're not answered by the community in which we'll be receiving the program, then your program won't be very successful. So you might have all the pieces together, but if it's not something that's feasible, if the family doesn't have a cell phone and the program is via phone or a phone, then you're not really going to be able to make much difference. So we really try to incorporate that idea of human-centered design into our design process as well. And that can be through focus groups, through one-on-one interviews, having people from the target population or from your participant group on your advisory board. So really making sure that participants are included every step of the way.
Kate, how would you say we treat our aging population compared to those in Bangalore and India?
So that's kind of a tricky question because the cultural factors are so different, right? So in India, for example, if you are to go to the hospital, it's not uncommon for your entire family to move into the hospital with you. And average length of stay in India is much longer than we have here in the United States. So for example, at Henry Ford, our average length of stay really is about 3.5 to 4 days, whereas in India, it can be a few weeks. So really the family travels with older adults to the hospital, and they usually live together in the same areas. Whereas in the United States, it's not uncommon for, siblings to be spread out throughout the entire US. And that's where genusConnect really comes into play, because it can connect those pieces when you're not physically living next to each other. So in terms of how we treat our aging population, I think it's just a difference in culture and a difference in customs. So like I said, in India, they usually live in the same village, in the same town, in the same city. They live by each other, and they can travel with each other to the hospital and stay for the entire length of stay of weeks. Whereas in the United States, we're just more spread out, and that's why we just need to adapt to what the situation here is in the US. And we think that genusConnect can be a way to connect those pieces even when they're spread, coast to coast.
You learned certain things from your trip to India and you brought them back here to the Detroit metropolitan area. How are some of these methods now being applied to caregiving in Michigan?
So a lot of the main point that we learned in India, like I said, other than the human-centered design piece, and we have some really great tools and processes of how we're going to develop our program based on this methodology. But what we really learned from them is the idea of very customized either thumbnails or videos about specific medical conditions. So in India, when they work in the hospitals and turn these hallways into classrooms, they focus on one specific condition, and they teach them very specific tasks that are needed to be done at home related to that condition. So for example, if we're working with an asthma patient, we want to teach them how to use an inhaler at home, or different sort of breathing techniques. So we've been customizing videos based on the older adults of certain chronic conditions. So whatever condition they have, we've picked the top 3 that are the highest in readmissions, which is COPD, congestive heart failure, and sepsis. Those are the highest in readmissions in the age of 60 years of age and older at Henry Ford Allegiance. And we're looking to customize, our education and tools and training around those 3 conditions.
Kate, how has the Global Health Initiative adapted to COVID-19?
So we've, as I mentioned, we've adopted in the sense of, we've really taken over a lot of the testing and operations of the health department, in the sense of making sure that the mobile units are up and running. We've provided staff, we've staffed volunteers, and it's really been a really beautiful public-private partnership between Henry Ford Health System and the Detroit Health Department, and really a cross-collaboration between knowledge and skills. So we've worked really nicely with the health department in making sure that we can have the largest impact and bring as many skills and backgrounds and expertise to the table as possible.
Kate, as we're doing this show, we have a lot of controversy over wearing a mask, not wearing a mask, wearing gloves, not wearing gloves, social distancing. What are some thoughts on these issues that you would like to share with our viewers before we sign off?
So, controversy, in terms of social distancing, I think it is, again, since public health looks at populations, it's really based on population risk. Of course, as they say, wearing the mask and making sure that you're social distancing doesn't necessarily always protects you, but really helps protect someone else that you might come in contact with. So even if you yourself are low risk, that doesn't mean that those that you come in contact with are low risk. And as I said, we don't just look at individual patients, we look at the entire population. So while your risk might be lower, in general, in your community, the risk might be higher due to, the zip code, where you live, whether there's a more aging population or not. So it is really important to continue practicing social distancing, wearing a mask when you're out, and really making sure that we can flatten that curve and that we can go back to our normal lives as soon as possible.
We have 2 minutes left, and what I'd like you to do is expound on any issues that we haven't covered or anything you'd like to share with our viewers before we sign off. This is important. This is really your chance to tell it like it is.
Well, I think I just kind of might want to highlight some things that I mentioned during this interview, especially just that idea of cross-collaboration. So at the Global Health Initiative, our mission is that we serve vulnerable populations, but we can only do that by working with others, whether that's from somewhere else across the world or in our own city, in our own neighborhood. So that cross collaboration, whether it's a public-private partnership between Henry Ford and Detroit Health Department, whether that's clinical community partnership, as in the caregiver program with an area agency on aging and the hospital, or whether that's a global local partnership between Nora Health and our caregiver team. It really just makes the experience that much richer and really just makes sure that our programs are going to be more successful and that we're going to have the largest impact on reducing negative health impacts on the communities in which we serve.
Kate, we're all in this together. We're going through something that has been unheard of. No one has seen anything like this in our lifetimes. And I really thank you so much for sharing your views. This is an important topic. This is an important show. And your work is so critical now. And public health is really a new meeting. So we're running out of time. I want to thank you so much for being my guest on Gracefully Graying. And I want to thank our viewers for watching Gracefully Graying. This is such an important topic, and you've really handled it admirably. Thank you so much.
Thank you, Henry. Thank you for having me.